All right, let's talk about something that's right at the intersection of mind-blowing and deeply personal. We're talking about the collision of artificial intelligence, our own genetic code, and what it means for our future health. It's a world with incredible promise, for sure, but it's also kicking up a whole bunch of really tough questions we all need to start thinking about.
So just start with this idea. Imagine your phone, your watch, maybe even sensors in your home, all of them constantly gathering this invisible stream of data about you. Now, imagine an AI sifting through all that data, looking for tiny, subtle patterns, changes that could signal you're getting sick long before you ever feel a thing. It's not science fiction anymore. This is the future that's being built right now. The real question is, are we ready for it?
So first, let's just get a handle on the sheer scale of this change, because the potential here is, well, it's staggering. AI is poised to transform pretty much every single aspect of medicine as we know it. And look at this. This isn't about some far-off future cure. This is about the here and now. We're talking about $60 to $120 billion in savings every year. For hospitals, that's money saved just by using AI to make things run smarter, optimizing schedules, managing supplies, and cutting down on waste. It's about making the entire system drastically more efficient.
And you can see here, this isn't just one little corner of medicine, it's everywhere. We've got AI that can read X-rays and CT scans, sometimes with more accuracy than a human radiologist. It's in the operating room, helping surgeons be more precise. It's even being used to make public health campaigns more effective and equitable. But, one of the most exciting areas has got to be personalized medicine.
And this is a real game changer. For decades, medicine has basically been a one-size-fits-all deal, right? Treatments are based on what works for the quote-unquote average person. But AI can change that. It can take these massive, incredibly complex sets of data, your unique DNA, your lifestyle, your whole medical history, and help create a treatment plan that is built just for you. And don't think for a second this is just some academic idea. You just have to follow the money. This is a massive, booming industry. The market for these AI-powered medical devices, it's projected to explode to over $35 billion in less than a decade. The investment is pouring in, which means this tech is coming, and it is coming fast.
But, and you knew there was a but coming, right? All this incredible power to predict our future health, it comes with a price. A very, very human price that we're really only just starting to wrap our heads around.
This quote right here, it just cuts right to the heart of it. Imagine knowing you have a high risk for a disease, especially one there's no cure for. That knowledge can create this heavy burden of anxiety, this constant cloud of uncertainty. Is it always better to know? The answer, it turns out, is not so simple.
Yeah, this new power to see into our biological futures, it doesn't just give us a technical problem to solve, it shoves us headfirst into a really complex ethical maze. Suddenly, we have to ask these huge questions about what it even means to be healthy, who gets to own our most personal information, and what the real cost of knowing actually is.
Okay, so let's try and navigate this maze a little bit, because researchers have started to map it out, and they've identified these key ethical issues that pop up again and again when we talk about this technology. So here they are. These 8 themes are kind of the main pathways in this maze. They cover everything from the really practical stuff, like can we even trust the test results, to the really big philosophical questions, like how we even define health itself. Let's focus on a couple of the biggest conflicts here. So, at the very heart of all medical ethics, you've got this fundamental tension. It's a push and a pull between these two ideas. On one hand, you have beneficence, the duty to do good. We should use this knowledge to prevent disease, right? But on the other hand, you have non-maleficence, the duty to do no harm. And the knowledge itself, especially if it's uncertain, can cause real psychological harm. It's a classic dilemma.
And that brings us to maybe the most immediate practical problem of all. The power of these predictions is only as good as their accuracy. So what happens when these incredibly powerful tests just get it wrong?
Okay, now this is a jaw-dropper. A study looked at people who took their raw data from a consumer genetic test, the ones, and then used a different company to interpret it. What they found was that a staggering 40% of the scary-sounding genetic risks they were told they had were just flat-out wrong. They were false positives. Now, why does that happen? Well, it's because consumer tests and clinical labs can use totally different methods. 40%. Just think about the sheer amount of fear and anxiety that number represents. It's huge.
And here's a related problem, but it's a bit different. It's called overdiagnosis. This isn't a wrong diagnosis. The condition is technically real, but it's a condition that was never actually going to hurt you.
With super-sensitive screening, we can start finding and treating diseases that would have just laid dormant your whole life, causing all the stress and side effects of treatment for absolutely no benefit.
Now let's zoom out even further, to the whole of society. The big risk here is something called medicalization. By focusing so much on risk factors, we start to blur the line between being healthy and just being at risk. We could end up turning a huge population of perfectly healthy people into anxious pre-patients who are just constantly waiting for the other shoe to drop.
And of course, the big one, privacy. In the United States, there's a law called GINA, and it's supposed to stop health insurance companies and employers from using your genetic data to discriminate against you. That's good. But, and believe me, this is a huge but, those protections do not apply to life insurance, to long-term care insurance, or to disability insurance. That leaves this massive loophole where you could be denied coverage based on a risk that's just written in your DNA.
So with all these massive challenges, how do we possibly move forward? How do we take all the incredible promise of this technology while still protecting ourselves from all the very real dangers?
Really, it all comes down to balance. It's a tightrope walk. We have to figure out how to encourage all this amazing, life-saving innovation while at the same time building the guardrails we need to make sure it's rolled out responsibly and ethically, because rushing ahead without a plan is just as risky as not moving at all.
So what does that responsible path actually look like? Well, there are some clear steps. First, we have to demand transparency. We need to know how these AI models and genetic tests actually work. Second, we have to ensure this technology is accessible to everyone, so it closes the health gap between the rich and poor instead of making it wider. And third, we absolutely have to close those legal loopholes and create real, comprehensive data protection for every single one of us.
And that kind of brings it all back to a final, really personal question for you. After seeing the incredible potential and the profound risks, if a test could tell you the secrets hidden deep inside your genes, revealing your future health risks, would you want to know?